I'm trying to achieve safe, effective care. I want to avoid readmission. I want the patient to be confident and competent, and I want those around them to feel the same, to be able to deliver good care in the community. And I also want the patients to know that they have the support of both my team and the Nutricia company nurses. And I think it works extremely well.
Serena Skerritt is the clinical nurse specialist in enteral feeding at Addenbrooke's Hospital. She's worked with the nutrition nurses for many years and is clear in her assessment of the benefits of the service.
It's a tall order to expect a patient to come into Addenbrooke's or another hospital to have a pH test. This is obviously a test of their stomach aspirate, when that can be done at home. So that's an example where they haven't been able to get an aspirate back. They're very worried. They've been told and have been taught that they must check their tube each time, the placement of their tube each time they use it. So if they can't get an aspirate, that's going to cause anxiety. So that's where they can ring up the company nurse. Without a simple intervention, like a nurse coming to check that pH, that patient won't be able to feed, that patient will become hungry, that patient may become dehydrated, but most of all, that patient will become extremely anxious, and so will their family member or carer. So it's something that can be addressed in the community without bringing them straight to accident and emergency. If we didn't have the company nurse, that would actually become a much bigger thing for the patient, because we'd have to bring them into Addenbrooke's and spend time with them. And actually it takes the pressure off us as a nursing team in an acute hospital, but at the same time it complements what we do.
Sure that nothing's untoward's happened.
I get very frustrated when I see other centres that don't have company nurses, because often these can be very simple problems to resolve, and it gives comfort to the patient, and it also gives a seamless flow of patient care.
Use it, but it was a lovely, easy tube change, so I'm not worried in the slightest. Okay. And I'll see you in July. Yeah. Unless you need me before. All right. Yeah. Unless you need me before. Yeah. All right. Okay. That's yours to keep.
The community as a whole, district nursing teams and other healthcare professional teams, are under huge amounts of strain, have little resource, and we find that our district nurses cannot support our patients, which is why, for us, it is so important for the Nutricia company nurses do so.
Patients absolutely want to stay at home, and we facilitate that by supporting them in the community, providing ad hoc visits when they need to, and support existing services that are there. But where services are stretched, our nutrition nurse service can bridge that gap and facilitate the patient staying at home where possible. Being able to be at home and in the community and living their life, which is the important thing, they need to be able to live their life, is crucial really for them, and that's all people want to do, is they want to be at home. They don't want to be in the hospital.